Hi everyone, I'm Dr. Jide. Welcome back to Health Conversations with Dr. Jide. Today we're breaking down one of the biggest NHS questions: when to go to accident and emergency versus your urgent treatment center in the UK healthcare system. Every day, patients make that exact decision, and sometimes getting it right can save you hours of waiting and ensure you get the right care faster. So let's talk about when to go to an urgent treatment center and when you really need A&E. How do you understand the difference? Let's start with what each service is for. A&E, or accident and emergency, is for life-threatening emergencies. Things like severe chest pain, difficulty breathing, collapse, heavy bleeding, or a serious head injury. That's where you need immediate hospital level attention. But if you've got something that's urgent, but not life-threatening, say a sprain, a cut that needs stitches, a minor fracture, or an infection that can't wait till Monday, that's where your urgent treatment center or UTC comes in. These centers are designed to handle those in-between cases, serious enough that you shouldn't wait, but not an emergency. So why do people get confused? You know what? It's totally understandable. Based on your area in the UK, some centers are called walk-in centers, others say minor illness and minor injuries units, and then you have UTCs co-located with A&E. So this can feel like a maze. The key thing to remember is, if it's urgent, go to a UTC. If it's life-threatening, go to A&E. And if you're unsure, call NHS 111. They'll help direct you to the right place. What do you expect at each of these services? When you walk into a UTC, you'll usually be seen by a nurse first for triage. That's a quick assessment to decide who needs to be seen sooner. You might then see a GP, nurse practitioner, or advanced clinical practitioner for treatment. At the A&E, however, the system prioritizes the most critically ill. That means if you're stable, you may wait longer, not because you're forgotten, but because the sickest patients are seen first. Understanding that helps you to manage expectations and avoid frustration. So let's run through a few quick examples and see if we understand where to go. A sprained ankle, yes, UTC. A deep cut that might need stitches, UTC. Sudden crushing chest pain, A&E. Your inhaler or medication has finished and needs replacing, UTC. A child with a mild fever but otherwise playful, probably GP or 111, but not A&E. Or a child who's floppy, breathing fast or not responding normally, definitely A&E immediately. It's about choosing wisely so you get the right care at the right time. So next time you're not sure where to go, think of it this way: life-threatening equals A&E, urgent but not life-threatening UTC, and if you're not sure, call 111 first. They'll guide you. I hope this helps you feel more confident about where to go for care. Next week, we'll look at what really happens when you call NHS 111. Another mystery we'll need to clear up together. I'm Dr. Jide, helping you understand healthcare one conversation at a time. See you then.